It's 2 o'clock. I'm Olive Martini, and this is the Working on Wellness Radio Forum that we do once a month on the second Wednesday of the month. And my guest today is Dr. Stephen Adelman. He's a licensed clinical psychologist. After retiring from the U.S. Army, where he completed his bachelor's and master's degrees in counseling services, he earned a doctorate in psychology at Forrest University of Physiological Services. Dr. Adelman has worked with blended families, trauma victims, and substance abuse, and now works with Healthy Families and Sequim Free Clinic, where he works with traumatized children and adults. And so today we're going to be talking about the types of traumas. So welcome, Dr. Adelman. I'm just going to call you Doc. How's that?
That's great.
Okay.
It's kind of like, what's up, Doc?
That's right. So can you tell us what can cause trauma?
The main things that cause trauma is if you see somebody injured, right in front of you, if you witness some type of horrible accident, if something really bad happens in your family even, just about anything that's out of the ordinary can do it. I've seen a lot of soldiers in war that were traumatized, and many times they were traumatized not by something that happened to them, but like they would be in the middle of a firefight and two of their friends would get blown away next to them. And it would take them years to get through that trauma that they saw. So it can be a lot of stuff. And people are different. Some things that wouldn't traumatize one person might traumatize another. We're all wired differently.
So what is acute trauma?
Acute trauma is something that happens. Something that actually happened, like a traffic accident happened. Something that just out of nowhere. I work with these two kids that were, their mother was a homicide victim. She was killed in front of them in her living room. This happened in Montgomery, Alabama a few years ago. I was working with the kids afterwards, and that would be like an acute trauma.
So how do you get through that with them? How do you work through that?
The sooner the intervention, the better.
Okay.
With kids especially, the sooner the intervention. And what you do is you work with them and get them to talk about what they saw and how they feel, and get to the point where they know that it's okay not to feel right. And just kind of work with them, try to help them, because a lot of times right after trauma like that, they'll start having nightmares and dreams. They'll get night terrors, all kinds of things. And just trying to work with them to help them get through that and know that they're not alone. And also to make sure that they have a lot of support right around them, that they have a family right around them, that they know loves them.
How do you work with adults? Same way? Same
way, making sure they have support. I've worked with people of all ages, and the way you have to work with adults is differently for every one of them. There's a lot of different therapies out there, but not one therapy works for everybody. You have to figure out what that person's comfortable with and what seems to be helping. If you just stick to the same old therapy with every person you see, it ain't going to work. That dog don't hunt. And I've learned that. And a lot of therapists don't know that. And they keep using the same therapy on people where it won't work, so they're not trying other things. But the biggest thing that has to happen between a therapist and a patient is connection. I don't care what your credentials are, but if you can't connect with the client, you're not going to go anywhere. So getting that connection in place where the person that needs the therapy feels that they can trust the therapist or trust who's working with them, that's the number one thing right there before you can move on.
So what is complex trauma?
That's where more than one thing happened. I've had some guys that came out of the Army. I had this one guy that I worked with for a long time, and I still see him occasionally, actually. He was in the Army, and he was in a lot of combat situations where he got shot at and he saw friends killed. And then after he got out of the Army after a 6-year hitch, he turned around and became a prison guard. And the trauma from watching people die in prison and all that kind of compounded itself on top of the trauma he had when he was in the Army. And so we worked for years helping him get through all of that stuff. So that's what I would consider a complex trauma, of more than one thing actually causing it.
Are some people traumatized and they don't realize it and something triggers them?
Yes.
How does that happen?
It just happens, it'll be in your unconscious mind. Something happened, it's buried, and then all of a sudden something that'll remind you. Like, I give you an example of a child who was sexually or physically abused, and at the time, they kind of bury it and they forget about it and they move on, but then all of a sudden they'll smell a smell or something that smells just like what happened when they were traumatized, and it'll be like a trigger. Mm-hmm. It'll bring them right back to it.
So how do you work through that?
Then you try to turn around and teach them. Sometimes exposure therapy helps, where you bring them around different smells and different situations that were close to the trauma, just slowly at sure, to see if they can kind of desensitize to what actually triggered them.
Okay.
And sometimes that does work. It's interesting because I had this one gal, she had panic attacks every time she got in a closed space. And a lot of it was because she was trapped in the closet as a kid. Well, what we did was since she had a hard time being in her car when she went through a car wash, I had her going through the car wash, when the car wash was running in the car, and actually having a little bit of ice cream and listening to really great music while she did it. And after about 4 or 5 times through the car wash, it kind of got to the point where she can get in more closed spaces and not, trigger out.
Let's talk about chronic trauma.
Chronic trauma. A lot of folks from World War II and from Vietnam suffer from chronic trauma. They go to a lot of treatment programs, and it still seems to bother them and goes on and on. And the best example I can tell you about is my father-in-law, Tiny. When he was alive and he slept with his wife at night, he'd been in the Navy, and the boat that he was in had been blown out from under him. He was a Seabee. And so the next 40 years, he kept rescuing his wife from that boat. She would sometimes find herself on the floor at night saying, "Oh my God, he rescued me again." But it just chronically just went on. And that's what a lot of folks I've met, especially from Vietnam, that have had this chronic trauma. It just hangs in there. And it doesn't seem like most of the treatments work as well as we'd like them to. A lot of times people are placed on medication for it, and some of the medication helps minimize or bring down the symptoms that you get from it, but not always.
Okay.
A lot of veterans and a lot of people that have this chronic trauma go to alcohol or drugs. They see that's the only way they can relieve. One of the guys that I worked with for a long time had this chronic trauma, and he would not go to sleep because at night his dreams are so horrific that he was afraid to go to sleep. And finally he died of alcoholism. So, that's pretty good examples of what chronic trauma can do.
How unhealed, unprocessed trauma can affect a child going into adulthood?
When kids get this type of trauma that really, like I said, different people are wired differently. Some kids I've seen, they turn around and they can go through trauma and whatever and just get over it and get on with their lives. But some kids can't. The thing that they've discovered over the years is that neurologically, your brain changes from trauma. The way you think and the way you react to things changes when you've been traumatized as a child. That's why it's so important to get them treatment as soon as you can, so you can help them keep their thinking straight and help them, stabilize their thinking. When you have some type of trauma, usually you will have the memory of what happened, and then there'll be emotion that goes along with that, something bad happening. The secret is to get the trauma processed appropriately to where the emotion attached to that memory will go away. The memory will be there and you'll still remember what happened, but you won't trigger anything because the emotion is gone.
Okay. So what are the types of trauma therapy?
And this is great because this leads right into what they call EMDR, eye movement rehabilitation type of therapy. And what that does is they found through eye movement, and a therapist can actually work with the client and actually get the darn trauma, the memory of that trauma, removed from the memory. Or not removed, the actual emotion removed from the memory, separating them out. EMDR has been very successful in doing that. I've been doing EMR now for 2, 3, maybe 4 years. I'm certified in it. And I found some patients really react well to that. But basically what you have to do with EMDR is you have to go all the way back to the first trauma the person has had, which might be when they were 3 or 4 years old, and just start going backwards, working back to present day to try to remove all those darn emotions they've had attached to all these different traumas during the years, or the memories of those traumas. So at the end, they'll remember what happened, but they won't react to it anymore.
Okay, and that's E as in Edward, M as in Mary, D as in Doc,
and R.
And R as in Robert. So what does that stand for again?
Eye movement, rehabilitation therapy, basically
Okay.
is what it is.
Okay. And so how does that actually work?
You actually, there's several ways you can do it. Actually, the therapist will stand across or sit across from the client.
Okay.
And actually will move their finger back and forth, having the person's eyes follow that person while they talk about what happened and talk about what they're feeling.
And they follow the movement of the finger? Yeah. Is that what they do?
Yeah, because it's called bilateral stimulation when you're doing that, okay?
Is it sort of like hypnosis?
No, they're
Okay.
totally conscious.
Okay.
In fact, you want to make sure when you're working with somebody that they are in the here and now,
Okay.
and they're not disassociating and are somewhere else, because then you're not really working with the person anyway. So the person is fully aware of it. But bilateral stimulation can also be, the person can be, they can be tapping their right leg, and they tap their left leg, right leg, left leg. They can actually do that themselves to do this bilateral stimulation if they don't like the eye movement, because that'll still stimulate the right side and still stimulate the left side. So go ahead.
So does this help them concentrate on the trauma itself so that they can work through it?
It just helps them release the emotions.
Okay.
So you're working on what actually happened, how they're feeling, and then you talk about what happened while you're doing it, and then afterward you see how they feel.
Okay.
And if they're feeling a little bit better, then you keep trying it again. And this may go on for days and weeks and months. But it doesn't work with everybody. Different therapies for different people. Some people, when you even introduce going back at any of these old memories that have this trauma, they can't handle that. And sometimes that's not for them. So when you're working with somebody, you have to make sure that you're not re-traumatizing by what you're doing with them.
Okay.
It's very easy to do that if you're working with a patient that can't handle it.
Okay. Doc, what is cognitive behavioral therapy?
That's typically talk therapy, where you actually go into it with people, find out what their problems are, and process their problems with them, where they're aware of what they did and they're aware of what you're doing, and you're trying to get their thinking to change. You're teaching them how to cope with different situations. A lot of people need different coping skills on how to cope with their problems. And I'm not smarter than the people I'm talking to. It's just that they're in the box and I'm outside the box. And sometimes when you can see things and you're outside the family, you're outside the box, you can see them pretty clearly. It's just like I would never try to do any type of therapy with anybody in my family because my emotions would probably bias me. So that's basically what you're doing. You're going in, you're finding out what their problems are, and you're helping them process through those problems. I wanted to mention one other thing too. On EMDR, that's eye movement desensitization rehabilitation. I was looking for that one word. And for some reason, I'm 78, and I get blocks. But cognitive behavioral therapy is a favorite of most therapists. It works really well. It works with all generations. Now, if it's a young child, 4 or 5 years old, 7 years old, then you just might want to do behavioral therapy. That's what you're just trying to get a child to maybe change their behavior. A lot of times they may not have the intellect yet to understand cognitively why you're doing what you're doing, but you're trying to get them to move around to a different direction. So that would just be called behavioral therapy. But cognitive behavioral seems to be the favorite for most of the clients that I've worked with over the years. Okay?
And what is prolonged exposure therapy?
It's what I talked about before. It's getting people to be around triggers and being able to desensitize them to those triggers. Sensitization, desensitization is like this. You put your wristwatch on in the morning, right? Do you feel it's there? No. You're desensitized to it. And that's it. Do you feel your underwear? No. You're desensitized to it. So we try to desensitize people to what really triggers them. It's like I told you earlier about this girl that went through the car wash in her car. Well, that was one way of doing it. But sometimes getting people to be around things that formerly scared them. one person I knew really could not handle being around snakes rather. And I saw another person who was really well versed with snakes, able to get that person gently and slowly get used to being around a snake and desensitizing them to it. And that's what that's all about. But long exposure, it takes a while. And if you try to make it too fast, you'll just re-traumatize the person.
Yeah, I don't like snakes.
Yeah.
I don't know if that would work for me. But tell us if, for instance, if someone is afraid of flying, how do you work with them?
Calm them down. Sometimes you could even put them in a plane. You could take them out to the airstrip and meet up with a private owner and see if they can just sit in the plane, explain the controls to them, explain it to them, and just get them used to being in there.
And so it's just a matter of just kind of working through whatever it is that they're frightened of, and do you use another tactic to take one trauma and
sometimes in the case of the airplanes is you actually work with the doc, and actually sometimes you put them on some type of tranquilizer, a real mild one, to help them the first 2 or 3 times that they fly.
And do you find that the more they're facing these traumas, the better they do?
Yeah, but very gently and very slowly. But not everybody. Everybody's different, and some people don't react right. I used to teach rappelling and rock climbing years and years ago, and I taught this at Northern State University when I was an ROTC person, ran an ROTC unit in South Dakota, and we were teaching people how to rappel. And a lot of the faculty wanted to learn how to rappel with the students. And some of them had height fears. They were very afraid of height.
Okay.
And so we'd be very, very gentle with them and teach them very, very slowly and walk them through it and do it in tandem even, somebody next to them, until they actually could do it. And some of those folks that had been afraid of heights all their lives, all of a sudden they were able to rappel, and it was like the happiest time in their life.
Well, you talked about the woman that you helped who was afraid of being in enclosed spaces.
Yes.
Remind the listeners about her story and the car wash.
Yeah, she'd been locked away in closets as a baby and as a kid. Horrible type things for years. She was emotionally abused, and that happened for years. And so when she came to me as an adult, she still could not get in tight spaces, and sometimes even had trouble getting in her cars. And we gradually got her to the point when she was driving that she could go through the car wash. And in the car wash, she would eat her favorite ice cream and snack on it while the car wash was pulling her along, and she would listen to her favorite music. And after doing that a few times, she could go through the car wash without anything, and it really helped her. And she started feeling more confident in herself, and she was able to get into smaller spaces, which really, really helped.
Do you have any instances where you've helped a child that they haven't really had a chance to live for a long time with the trauma? How do you say getting to them right away is
that's the way, an interaction right after it happened.
Okay.
Some type of intervention. Getting into an intervention and letting them know that they're loved and they're surrounded by people that will protect and support them immediately. And then getting them to be able to talk about what happened to them. Getting them to, actually do that. And sometimes it's very hard, especially I've worked with a lot of sexually abused kids, and it's really hard for them to talk about what happened. But getting them to actually talk about it and getting it out is really important, because then they realize that they're not the only one. And if you work with a child long enough and they actually start feeling better about themselves and know they're not the ones that caused it, they're not the reason why this happened to them, all of a sudden they go from the status of being a victim to being a survivor. And they start being confident and proud of themselves after they realize, and they get strong.
Okay.
But that's the goal right there, is to get them to go from being a victim to being a survivor. And it takes constant work with them.
And so, did the police call you for when they realize that something like this has happened, and do they call right away? And
I worked with 4 child advocacy centers over the years.
Okay.
In fact, I was a clinical director for the Child Advocacy Center in Montgomery at one time, and the police would immediately bring a suspected victim into us.
Okay.
Where we immediately, with kindness and and friendliness, try to get the child to tell us what happened, but in a very kid-friendly manner.
Okay.
And that's what we did. But the police, the Montgomery police would bring the kids to us immediately, and we'd see what we can do and help them. And then as soon as they had done this, we'd immediately put them into therapy to get them, to continue on to recover from what had happened to them.
What is prolonged exposure therapy?
Well, that's what we were talking about before. That's where it takes a long time. If you have somebody that has post-traumatic stress disorder and they've had it chronically and they've had it for a long, long time, it may take a lot of time to exposing them to whatever is triggering them to get them through that, if they can even get through that. That's basically what we're talking about.
Have you ever had cases where you've worked with someone and how long do you work with them before you realize that you're not getting anywhere? What happens then?
I worked with this one gal a while back, it's probably 2 or 3 years ago, that I wanted to get her into working with EMDR, eye movement desensitization rehabilitation therapy. And I told her we'd have to go into her old traumas going from childhood on. About the time, and I told her exactly what was required, and we saw each other for 3 or 4 times where I established a good relationship with her. But about the 5th time, she got to thinking so much about how horrible it would be to think about those traumas she went through that she could no longer even talk to me.
Okay.
It was just too much for her to even think about doing it. And all you can do is back off because you
Sure.
don't want to re-traumatize somebody.
What is PTSD?
Post-traumatic stress disorder.
Okay.
It's called a lot of different things. A lot of people that were in the service during Vietnam and World War II have had it. And what it basically is they have these horrible symptoms, these horrible nightmares, reoccurring nightmares over and over again about bad things that happened. I had this one soldier that I work with that he'd been in a firefight, and he was the only one that survived out of 5 of his friends. And constantly went over and over again every night, reoccurring dreams. And that's the other person I talked about, his dreams are so horrific that he wouldn't go to bed at night and he could never sleep and ended up using alcohol to sleep. You'll see some people that'll have a startle type of thing that will happen to them, and a startle example of a startle symptom would be like a car backfiring. You see a car backfiring, then you see some soldier just came out of combat that'll hit the ground.
Yeah.
You think a bomb just went off. Any kind of loud noise will disturb them. I work with a couple of veterans in Klamath Falls, Oregon, where they had been since Vietnam ended, they had been in the boonies, in the mountains, living on the land, because they did not ever want to go into a building again. And when they came to me for therapy, they were already in their 40s, and their bodies weren't doing too well living on the land. So they figured they're going to eventually have to come into, live like a normal person. And so it took me a good 2 to 3 times of seeing them before I could get them off the picnic bench in the back of the building to finally come into the office. That's how traumatized they were of being enclosed in space. And when they sat, they had to sit with their back had to be to the wall where they could see everything coming in because they had the paranoia about them.
Right.
And this hypersensitivity is what a lot of them get, and it's from survival.
Sure.
They had to be like that to survive where they were at. And it's the same thing with a lot of women who've been domestic violence victims or victims. They have the same type of survivability instincts because they've been in places where if they didn't, they would have died.
Talk a little bit about the holidays this time of year, what people go through.
Yes. I worked the suicide line in El Paso for about 5 or 6 years and used to train people. And one thing we found out in suicide line, your busiest times of the year were at Christmas time or Easter. And this is no joke. When there's a full moon out, we have a lot more action. If you had a Friday night with a full moon, let me tell you, there was a lot more going on. But people in the holidays get so depressed sometimes because sometimes they're not with family. They have no support around them. And so sometimes they want to take their lives, or they don't know what to do, or they just become alcoholics, or they use drugs, or anything to get into an alternate reality. Mm-hmm. But holidays are so difficult for so many people. So I would say to you, if you have a friend that's going to be alone, I would say bring them in. I remember when I was in the service and I was in a unit, we used to turn around, all of us people that were permanently there with our wives, we would always bring in all the lone soldiers that didn't have family and bring them home for Christmas and bring them home for New Year's so they weren't alone. And that's what it's all about. And that's why families can help people like that through that. But that's tough.
And so if people are struggling, you suggest that they get in touch with Peninsula Behavioral Health?
Yes, Peninsula Behavioral Health has good therapists. The other one that I was going to say was there's a Sequim counseling service. They're very good. They do a lot. And there's several other counseling and psychologists that are in the area that you can reach by phone. All you have to do is Google it and it'll come right up.
This is a time of year, Doc, when lots of people struggle, and we talked about how they can get help. And Peninsula Behavioral Health is one option that people have here on the peninsula. So talk a little bit about what they do.
They're great. They have therapists, but they also have psychiatrists. So if a person goes to them to see a therapist, they also can see the psychiatrist if they need to have medication.
Okay.
And that's one advantage that they have over seeing a lot of other folks that don't have actual in-house psychiatrists.
They have a 24/7 crisis support center that you can call. The number is 888-910-0416. And they have two locations here on the peninsula. One is in Port Angeles, and that one is on... their main clinic is 118 East 8th Street in Port Angeles. Their number, 360-457-0431. And in Sequim, they're located at 500 West 1st Street. So they're open like Monday through Fridays from looks like 8 to 5.
Yes. And not only that, there's also, you can get online and you can find all kinds of crisis lines that you can actually talk to if you're having problems. And if you're all alone by yourself and the holidays are coming, get on the line with somebody. These crisis services lines, they're more than helpful. They don't cost anything, and people will actually talk to you. When I worked for crisis services and I worked the suicide line in El Paso, we talked to people through the night. Many times people that had cancer, they would go to bed, their whole family would go to bed around 10, 11 o'clock at night, but the person that had cancer, they couldn't go to sleep because they were in pain. So we would stay on the line with them through the evening, through the night. So they had somebody to talk to, and some of them were terminal, and they needed just to talk to somebody. Mm-hmm. So these crisis services lines are very valuable. And I think if you think you have a problem, reach out to one of them. But the Peninsula Behavioral folks, they're there. And I've referred a lot of clients to them, and I've seen very good results. And the same with Sequim Counseling. They're excellent also, and there's several others out there.
When you believe that you might have some struggles, especially during this time of year, there are places to go and help that you can get. So talk to our listeners a little bit about that.
Reach out. Don't isolate. The biggest problem with people that get depressed in the holidays is they isolate themselves, and as a result, just get more and more depressed. If you can reach out to friends, support, or even get on a crisis line somewhere, it'll help. I think Healthy Families has a crisis line also in Port Angeles. But anything like that would dearly help you if you're in that kind of depression mode.
And if people want to speak with you, you are at the free clinic, which is the Dungeness Valley Health and Wellness Clinic, which is open to the public on Monday and Thursday evenings. They open at 4:30 p.m. No appointments are needed, and the Sequim Free Clinic serves anyone who has no health insurance or is underfunded. Their telephone number is 360-582-0218, and they are located at 777 North 5th Avenue in Sequim. Their website is sequimfreeclinic.org, and if you call and would like to speak with Dr. Adelman or you need a referral, they can help you with some of these other trauma centers that if you think you need help, you need to reach out.
Absolutely.
All right.
Absolutely. That's what we're there for.
Okay. Well, I want to thank you very much for coming in. And again, the Sequim Free Clinic is, their number is 360-582-0218. All right.